Welcome back, everyone. Brand new show here today on the Cabral Concept. Excited to get into one of my favorite topics, and that is nutrition, but not just any old nutrition. It's actually scientifically validated nutrition that's been done over dozens, and not just dozens, but hundreds of different studies all across the world showing the same exact thing. And one of the reasons why I want to go over this particular topic is that so many people right now are pre-diabetic, have blood sugar-based dysregulation, or already type 2 diabetic. So we're going to be focusing more today, not on type 1 diabetes, but actually high blood sugar and uncontrolled blood sugar in general. Uncontrolled blood sugar can lead to a host of different issues. Any inflammatory issue can be exacerbated by higher levels of blood sugar. And of course, that has everything to do with metabolism, hormones, weight gain, aging, Alzheimer's, etc. So that is why it's such an important topic. But, one of the reasons why I like to talk about nutrition so much is that this is a confusing topic for most people. And then, because let me give you an example right now. So the latest study that I was checking out and really going in depth on it, it's well worth reading. So if you'd like to read about research, I'm going to link it up for you here today. And I would highly recommend checking it out. And it's episode 2405. So just head on over to stephencabral.com/2405. Okay, so it's called the MEP Diet. I'm going to be going over it, but I don't want that to kind of sway you before I get started. So here's the thing. The MEP Diet is, and I'll give you the exact stats, but it's about 42% carbohydrates per day. So most people would consider that, well, I shouldn't say most people. It depends what camp you come from, right? Because low carb for some people is like sub 20 grams a day. So, it's hard to even qualify anything more anymore. But, back in the day, that would be considered a lower carbohydrate diet. So less than 50 to 60% of your diet would have been of carbohydrates would be considered lower carbohydrate. I would just consider it moderate. I think anywhere between 20% and 40% is, or 25 and let's say 50% is moderate. Below 25%, I would say is a lower carbohydrate diet. But again, it's who are we talking about? What type of carbs are we talking about? And that's really what we're getting into here today. Why do I bring up around the 42% mark? Here's why. They use this diet to help lower hemoglobin A1C. So when you're being diagnosed for diabetes, type 2 diabetes, you're looking at fasting glucose, and it's typically going to be above a 126 for fasting glucose when you wake up. That means you wake up in the morning and you just take a finger stick worth of blood. Again, you can get this for a $20 glucometer at your local pharmacy. You can find them at stephencabral.com/resources. I have the ones that I use there. You can use a continuous glucose monitor, whatever works for you. But typically you're fasting glucose after 12-hour, we'll say overnight fast. If it's a 126, you're trending then towards type 2 diabetes. Again, on this show, I can't give you medical diagnosis, medical treatment plans, medical cures, but we can certainly talk about all the underlying root causes to those things. Now, the other criteria, though, for type 2 diabetes is a hemoglobin A1C at 5.7 or above. So what this diet showed is that it actually reduces hemoglobin A17 by 0.3 points. And I'll find the timeline for you, but it was somewhere, it wasn't a short period of time, but it was, well, I don't want to misquote the study, so I'll get that stat for you, but it was somewhere around the 5-month mark. So we'll get you that. And what I can say is this, though. Oh, actually, so I don't like leaving these things undone. About 12 weeks. Okay. So here's the interesting thing. And this was the main point. The MEP diet is about the same amount of carbohydrates per day that the average person who has type 2 diabetes eats. And you might say, well, that doesn't make sense because isn't it when you eat carbohydrates, your blood sugar spikes? That's what every health expert basically would have you believe. I've talked about this before. I'm going to link it up on a previous show. Carbohydrates do not cause diabetes. Now, you might say, well, that's not true. Listen, I understand. I am not talking about processed food. Okay, processed food causes diabetes, but it's not just the carbohydrates. Okay, because if 42% of your diet is carbohydrates, then you have another, 58% coming from fat and protein. Okay, so the vast majority is not coming from carbohydrates, right? So I want to look at this in a few ways. The diet that I'm sharing with you right now is very high in carbohydrates, fruits, vegetables, and some grains. Okay, so why would a diet high in fruits, vegetables, and some whole grains lower glucose levels and hemoglobin A1C? The reason is it's the quality, it's the type. So I just have to reinforce this, that please do not allow people to share with you surface level knowledge and I would say fictitious based statistics on not whole truths, right? So they're saying carbohydrates cause diabetes. Well, not really, right? Processed carbohydrates from, white pastries and bread and things like that, yes. However, they are combined with hydrogenated oils. So these are fried foods, these are processed foods that are leading more towards diabetes. So let me share with you the difference in this diet. This diet is predominantly plant-based. Again, I know can already hear all of the carnivore and keto, crusaders pushing for that. All I'm doing is reading the research. That's it. I'm not against meat. I'm not against eggs. I'm not against fish. I'm not saying that you can't eat those things. Let's talk about the research here. It's very well done. This is very, very in-depth research. It's been done now for many decades. And it's not just, I stated hundreds before, hundreds on this, thousands of studies just on this specific diet. It's the best diet in the world for blood pressure, for cardiovascular health, for diabetes. That's the bottom line. There's no diet with more research behind it. I don't own the diet. I have nothing to sell you with this diet. Okay, so it's predominantly plant-based, abundant in fruits and vegetables. And yes, there are other types of cereals, which is another name for grains, as well as beans, nuts, and seeds. All right, so that's the preponderance of the diet. Fruits and vegetables, okay, fruit and vegetables. Then there's some oats and grains, and there's some beans, nuts, and seeds. Okay, then what else is there? All right, well, now let's see what else there is. There is high quality fats that make up about 30 to 40% of the diet. Okay, so we've got about 42% carbs and about 30 to 40% from fat. Where's the fat? The greatest amount, almost all of it, is coming from olive oil. So all of the added fat is from olive oil. This is important because I've talked about this before. Healthiest types of fats for everything from cooking, and I know it doesn't make sense because I believed it before I looked into the research, that just because it is not a predominantly saturated fat does not mean that it's not the healthiest for actually cooking. And again, I don't believe in heating oils. I'll just say that up front, I'm not an advocate of heating oils. But when you look at the research, why did olive oil fare as number one? The reason it did is because it has the greatest amount of protective oleic acid, a protective antioxidant that does not allow for the oxidation. Because typically a saturated fat would be better to cook in because it's harder to break down those bonds. The bonds are fully saturated. So that's one of the reasons why it gets its name. All right, so we've got predominantly the fruits, veggies, some grains, beans, nuts, and seeds. Okay, so 30 to 40% of the diet of fat, mainly from olive oil. Obviously, some of those nuts and seeds are going to be taken into account as well. It has a low to moderate dairy intake, mainly from cheese and yogurt, no real milk. A lot of that is sheep-based and goat-based. That's important to look at. It's not cows-based. The protein, red meat and eggs are consumed in small amounts with low frequency. Okay, so that means like once or less than once per week. Seafood intake varies based on where people are in relation to the sea, but it's at least a couple of times per week. Alcohol is consumed in low to moderate amounts with meal, typically wine, and herbs and spices are used instead of salt to add flavor to foods. Okay, so this, if you haven't already guessed, is the Mediterranean diet. And lo and behold, I know I've talked about the Mediterranean diet again. I understand, but the thing is, I'm just trying to share with you what is the best research so that you can live the longest, healthiest life possible. Like, that's the truth. There's no better research. You can say, oh, well, this tribe in the middle of nowhere has the longest life expectancy. Well, that's not true. Like, that's not actually studied. And their nutrition plan, pretty much every nutrition plan has been studied in depth now. I'm just sharing with you unbiased. This is without a doubt the number one. Now, in a true Mediterranean diet, the carbohydrate load is actually greater than 50%. So it's closer to that 60%. However, researchers have been using a low carbohydrate Mediterranean diet that they're calling the MEP, okay? Why is this important? The reason why this is important is because they actually want to use this And it's called, by the way, MEP stands for Mediterranean Eating Pattern. They have one for Americans called MEPA, but just let's look at Mediterranean Eating Pattern. And the reason why that they're doing this is to just not, I wouldn't say compete in the marketplace with diabetes and et cetera. However, they did want to compare, I would say, apples to apples. And even though the Mediterranean diet on its own is still better at lowering glucose than typical, diet, they wanted to say, hey, what if we compared studies? So they actually looked at, this is a 4-year study. So over that 4-year period, it was 44% for the low carbohydrate MEP diet, 44% from carbohydrates, and 45% is considered the normal carbohydrate load of Americans. So I think that's pretty important to look at, because then when you look at the specific studies, and then I'll give you exactly what to do after this. And again, there's a bunch of different studies. This was a meta-analysis of 9 of these studies, and then a second one from 18 studies with 20 different cohorts. And it showed that the MEP diet and also the DASH, which I've spoken about before, and I've given my critiques of both of those as well, because I don't think we should be eating a lot of processed grains. I've stated that before. I think these diets can be even healthier without those, as long as you are keeping that fiber and vegetables high. But they show really a consistently minimum threshold of reducing, if you don't already have type 2 diabetes, by 20%. And again, that's clinically significant, more significant really than any other type of diet that's been studied for the same amount of time. And what I want to share with you is one last thing, because this is confusing researchers. So research of the MEP diet shows cardiometabolic benefits. Okay, cardiovascular, vascular with blood pressure, and diabetes. So the reasons for the benefits are complex. I'm reading exactly from PubMed, by the way, which I'm going to link up. So the research suggests that the benefits come from vegetables, fruits, nuts, and legumes. They also come from reduced alcohol intake and reduced meat consumption. Another interesting note that the researchers said is that olive oil was not captured in the results. Other studies suggest that benefits are derived from key fat sources such as alpha-linoleic acid or olive oil and nuts. The benefits may be a result of individual foods or the consumption of combination of foods. Eating more high-quality foods, example, fruits, vegetables, whole grains, olive oil, and seafood, may reduce inflammation and result in improved insulin sensitivity in the peripheral tissues and improved endothelial function at the vascular level. Many of the individual foods have benefits. For example, research suggests that both quality and quantity of carbohydrates and fat matter in the relationship to postprandial glucose response, in particular extra virgin olive oil. All right, why does all of this matter? Well, here's what they studied. What was glucose response after the meal? Doing nothing special on a Mediterranean diet versus the typical diabetic-based diet where there's 45% carbohydrates. But again, it's not that, because they actually shared that a lot of that was fast food, fried food, hydrogenated oils. And there is some again, questioning of those saturated fats. And again, now here come the saturated fat police. But again, I'm just trying to share with you the actual unbiased data that saturated fat can go both ways. It can be very detrimental for some people, and some people have no effect whatsoever. Do you know if it's detrimental for you? You may or may not. Have you ever tested your ApoE genotype? Do you know you're allele? If you know you're allele and there's a 4 in it, whether it's a 3-4 or a 4-4, you have to be careful. If you're a 2-2, yeah, saturated fat's probably not going to affect you to the greatest degree. It's not. But I'll link up a few more of my podcasts as well on finding your particular allele or just understanding more about that. Okay, so the bottom line was this. The benefits could be derived not from the actual percentage of carbohydrates, so that's why we have to stop looking at macros alone. The whole world seems to be obsessed with fat, protein, and carb macros. Okay, well, I just showed you 2 different diets with 2 completely different outcomes with very similar profiles in terms of macros, okay? Let's say 45% carbs, and we're looking at, let's just say 35% fat. Okay, so we've got, what is that, 50, 80% coming from carbs and fat, both diets, and about 20% from protein. There's actually really nothing wrong with that diet. The diet that I follow and give to most people is very close to this MEP-based diet. It's not radically off from 45, 35, 20. Now, it can change. It changes on the person. Again, like if this person is more carb insensitive, we'll put it that way, they're going to eat less carbs. carbs. There's no doubt about it, but it's going to be as much volume of carbs. It's just going to be more vegetable-based than starch-based. But I'm going to save that for a different show. I've talked about that many, many times in our Fat Velocity weight loss-based system. Again, proven by clinical science to actually work. 25 clinical science studies behind the ingredients that we use, all of that. But again, I digress. Let me just actually give you the recommendations. All right. So replace butter and margarine with healthful oils such as olive oil. All right. Eating protein foods such as skinless chicken breast and turkey, or skinless chicken and turkey, fish, beans, and nuts, and other plant-based protein sources. This does not mean fake protein. It just means actual like plant-based protein, which could be chickpeas, etc. So eat fish at least once or twice a week. Eat or fresh, they just go through different fish choices. I'm not going to go that. Substitute fish and poultry for red meat. When red meats are eaten, choose lean cuts and keep proportions small, about the size of a deck of cards. Aim for 3 to 5 servings of vegetables per day. Choose whole grain breads and cereals, as well as whole grain pasta and rice products. That's where I take a little bit of offense. I've talked about this before, the DASH diet. The diet could be just as good, if not better, with saying, okay, maybe some oats if you want some oats, maybe some, again, add in whatever whole grain you want, but really you could replace that with more vegetables, and I think you'd be even healthier as well. Seasonal meals with herbs and spices rather than salt. Snack on nuts or seeds instead of snack foods. Let's see what else. Enjoy fruit for dessert. Again, you know how I feel about fruit for dessert. Eat small portions of cheese or yogurt. I think, again, that could be optional. I don't think you need to eat cheese to be a healthy human being. If you drink alcohol, limit it to moderate consumption with a meal. No more than 1 glass for women and 2 for men. And I absolutely do not believe that that is a health-based recommendation, but certainly, if you do that to lower your stress, well, you do that to lower your stress. But honestly, you're going to be a healthier human not drinking alcohol. And again, that's based on all of the science. Like all of the legitimate science is that alcohol is far more detrimental than you get benefit from. Now, am I saying you can never drink alcohol? No, just like I'm not saying you can never eat any meat or anything like that. What I'm saying is these are going to be done in much smaller amounts. That's all. As in relation, again, it could be a lot, but in relation to your fruit, vegetable, and fiber-based intake there. So hopefully this was helpful. I just want to share with you that really this is the best science out there for nutrition. It really is. Now, you can cherry pick certain studies that say, oh, keto diet's the best. This is the best. There are certain instances where you want to go really low carb. And again, you can look at that as more of a medical-based diet, though, not an everyday diet. Like that's the honest truth. An everyday diet has to be something that's sustainable, something that's well-balanced, and most of these diets are not. And most of these diets are not actually doing what they say that you're doing. If you are recommending a high-meat diet and calling it a keto diet, it's not a keto diet. That's just the way that it is. If the amount of protein is too great on a keto diet, it's going to raise glucose levels. I mean, that's how it works. Protein can be used as a carbohydrate substitute. And again, you can go into my podcast that break down all the different factors in which amino acids can actually be used in that way from protein. So I just think that we need to be just a little bit more cognizant, maybe a little bit more balanced as nutritionists and people in the field when giving nutrition-based advice. So I think that you can manipulate your macros to get the results that you're looking for, but in the end, we need to settle in for most people on a good foundational diet. And I think that the tenets and principles of the Mediterranean eating plan is certainly the place that I think most people should end up. Now, maybe for 3 to 6 months, you're on a specialty-based diet, working with your health practitioner, totally fine with that. But again, eventually, I think settling into a far more balanced diet is what's going to lead to the longest, healthiest life possible. And that's what I'm here to try to share with you. Hopefully today's show was helpful. Again, thank you so much for tuning in. And as always, if the show was helpful, please do feel free to share it with anyone you believe it could serve.